Welcome back to this episode on the section of mental health in the series of holistic health. In the previous section of emotional and social health, we had seen that the emotions and its effects can be removed through the medium psychotherapy. Now, this psychotherapy works on disturbances and disorders, but not in the third group of diseases. Today, we are going to discuss in this section about psychological diseases. Why does the psychotherapy not work on it? Because the cause of these mental illnesses is not in the situation around, but within the person. So, what is this cause? That our body has a network of nerves. At the junction point of the nerves, in that gap, there are certain chemicals called biochemical neurotransmitters. Their function is to convey the message from one nerve to the other. Now, sometimes there is an alteration in these neurotransmitters, so the message between the nerves does not pass properly, and that leads to some symptoms. And from those symptoms, we are able to infer which neurotransmitter is out of order and then give another chemical, that is the medicine, to set it right. So, how do we know that a person has some such mental illness? So, there are certain characteristic symptoms which indicate. So, let us first talk about these symptoms. The most important symptom is insomnia, that is, lack of sleep. Now, there are three types of insomnias: early night, middle night, and late night. Let's say a person sleeps at 10 o'clock and wakes up at 7 o'clock. In early night insomnia, there is difficulty in falling asleep. The person goes to bed at 10 o'clock but cannot get sleep for, say, 1 hour, 2 hours, 3 hours. He's just tossing and turning in bed, but the sleep doesn't come. This early night insomnia is a sign of psychological disturbance. There is some worry which is keeping the person awake. In midnight insomnia, there is no difficulty in falling asleep, but there is difficulty in sustaining sleep. The person is able to go to sleep at 10 o'clock, but wakes up in the middle of the night. Say maybe 12 o'clock, 1 o'clock, 2 o'clock, or 3 o'clock, and then is not able to sleep for some time. Maybe 5-10 minutes, maybe half an hour, maybe 2 hours. Now, this midnight insomnia is a sure sign of major depression, which is the depressive illness caused because of neurotransmitter imbalance. But because people are not aware of it, they will give some excuse or the other for the waking up in the middle of the night. They'll say the dog was barking, that's why I woke up. Or because I was worried, that's why I woke up. Or because somebody banged the door, that's why I woke up. They'll find any reason. Or they may say, I wanted to go to the loo and that's why I woke up. It's the other way around. Because they woke up, they went to the loo. Now, this is a pathognomonic sign. Pathognomonic means if the person has this symptom, definitely there is major depression. In late night insomnia, the person wakes up earlier than usual. Instead of the usual 7 o'clock, wakes up at 3 o'clock, 4 o'clock, 5 o'clock, and then doesn't get sleep again. This also is a sign of major depression, but when the depression is of the milder severity. When it becomes moderate, then the midnight insomnia develops. And when the depressive illness is severe, there is total insomnia. The person is not able to sleep a wink throughout the night. Second important symptom of mental illness is lack of appetite, anorexia. The person just doesn't like to eat. Delicious food is there, but he just doesn't feel like eating. This also is seen in cases of major depression. The third important symptom is panic attacks, anxiety attacks, in which the person feels very, very anxious. This may or may not be accompanied with peripheral symptoms like palpitation, chest pain, breathlessness, giddiness, tremors, perspiration. The panic attack may last for a few seconds to a few minutes to a few hours. The frequency may vary from person to person. Some person may have it several times a day, some may have it 2-3 times a week, some may have it once in 10-15 days. That's different from various patients. This also is a sure sign of major depression as well as obsessive compulsive disorder. However, the person, because of the symptoms, feels he has a heart attack. So goes and gets ECG done, which will turn out to be normal. Or because of the breathlessness, he feels that he's got asthmatic attack and keeps on taking the pump. But this is a panic attack. The treatment for this is giving an anti-anxiety drug. With that, the attack is relieved. But when the underlying cause is not treated, once you try to withdraw the medicine, it relapses. And now the people feel that they have got addicted to that medicine. It is not addiction, it's an incomplete treatment. You have only given a symptomatic relief with anti-anxiety without treating the root cause of the neurotransmitter imbalance. Another important symptom of mental illness is feeling sad without any reason, feeling like crying, feeling like committing suicide. This is a very important sign of major depression. And many times you may find the person may first kill the children and then commit suicide. These are cases of extended suicide. All these three symptoms are seen mainly in major depression. And if the illness could have been detected in time, such a tragic outcome could have been prevented. Yes?
Yes, sir. Many a times this thing comes as a whatever extended suicide. Many a times they feel that okay, person was very normal or everything was fine, and suddenly don't know whatever. There can be some stressor, but people do feel that it's a sudden. Suddenly it happened. There wasn't any kind of symptoms or any kind of problem.
Yeah.
So does it happen like without any kind of symptoms also people can take this kind of action, or there are definitely symptoms and which are missed?
Okay. See, in the course of the major depression is a parabolic curve. So when the illness starts, it gradually starts increasing. And as it increases, more and more symptoms develop. The initial symptoms are of sadness, crying and suicidal ideas. Later on, it is followed by what is called psychomotor retardation. That is, the person becomes slow. So, when the illness increases, the sadness, crying, suicidal ideas increase. But because of the psychomotor retardation, the person is unable to implement the suicidal ideas into a subtle attempt. Now, in the initial part, when the psychomotor retardation is yet not developed and the intensity is less, there are more chances of committing suicide. So you think he's done it out of the blue. Similarly, when there is recovery in the depressive episode, first the psychomotor retardation goes, then the other symptoms go. So towards the end of the illness also, once the psychomotor retardation goes, the person is able to attempt suicide. So we feel the person was recovering very well. Suddenly what happened? So one of the symptoms of the illness itself prevents the suicidal attempt.
So what precaution people should take in and around such people?
They should not be left alone first. They should not take lightly the expression of suicidal ideas. And they should institute the remedial measures as early as possible to help the person recover from this depressive illness.
Like students also nowadays, we hear in the news that they are committing suicide. Suddenly we get the news that they committed suicide.
True.
So that also could be the same.
Could be. It has to be confirmed. Most of the time, we do not even look for the symptoms of depression, major depression. And therefore, we blame any situation that was happening at that time.
They were blaming recently in the IIT peak. one student, they said that the other student, co-student, instigated him and
True.
he committed suicide.
True. So not knowing about this endogenous illnesses,
Yeah.
people blame the circumstances. Because that is what is evident to them.
Yeah, correct. That's exactly.
Whether it's appropriate here or not. Mentioning certain statements, what these people can make and which should not be missed, or we should make people surrounding alert if they are talking something like that.
Sure. Sure.
If you can.
Yeah, they may say, it is better if I am died.
Mm.
Or I would like to leave everything and go away. These are subtle hints that the person is feeling like ending his life.
But even if they say that, okay, I'm not feel like committing, but if like death comes,
It is welcome.
Welcome.
Correct. More symptoms about the depressive illness we shall take when we cover that topic little later. Another important symptom that you should look for is for the hypomanic episode. In this, there is change of moods. The person is either very elated, very happy, very boisterous, or there is an angry, irritable mood. So that also should alert a person that the person may have a mood disorder. Another symptom one should look out for is obsessions. Obsessions are unwanted thoughts that keep on coming in the person's mind against his wish. They are ego alien, that's not in keeping with his normal nature. On the contrary, it produces a lot of anxiety in the person. The person has insight into the wrongness of these ideas, but the person feels helpless. These thoughts are coming involuntarily. Like say our body has two types of processes. One is autonomous, that is it keeps on occurring without any effort on our part. Like the heart, the lung, the kidney, the intestine keep on functioning. We don't have to tell them. But the limbs, hands and legs don't move on their own. They are voluntary actions. Now, sometimes the voluntary actions become involuntary. Like in the case of Parkinsonism, the hand is trembling. The person doesn't want it to happen, but he can't help it. And why is it trembling? Because of the neurotransmitter dopamine reducing in the gap in the nerves. And if you set it right, this settles. Similarly, our thoughts are also voluntary. But when the serotonin neurotransmitter is lowered, the thoughts become involuntary, and these involuntary thoughts are obsessive thoughts. Two more symptoms. One is hallucination. What is hallucination? Hearing something being said which is not actually happening. So the person hears voices from the environment and he looks around to find who is saying this. This is a very sure sign of schizophrenia. Another important symptom is delusion. Delusion is a fixed false belief which cannot be removed by any amount of reasoning or by any amount of proof to the contrary. There are many types of delusions. The main one are persecuted delusion and delusion of jealousy. In persecuted delusion, the person feels that he is being persecuted, that people are against him, they are conspiring against him, they are trying to harm him, trying to kill him, plotting against him, or stealing his things. And these people may even approach the police station to lodge a complaint. In delusion of jealousy, there is suspicion that the spouse is not faithful to him or her. And many a times, such type of suspicion not only results in divorce, but sometimes even in murder. And this is a very sure sign of paranoid schizophrenia. Yeah.
So in the first case, is there any fear to the society from the person
About?
the safety?
Yeah. In the first place, in the hallucinations?
Yeah.
Yeah. Because when the person hears something, he looks around and there are some innocent bystanders.
Okay.
And he may feel that those people have said it.
Okay.
And therefore may go and quarrel with them or even beat them up.
Okay. So we need to stay away from such kind of people.
Yeah.
We need to help them to take the treatment.
Yeah.
Yeah.
But if they are not
Related to you. Means if you are innocent bystanders, but how will you know that the person is suffering from this illness?
no, but if we know, by chance if we know,
Huh.
then
Then try to make arrangements for his treatment.
but if he doesn't goes to the clinic, then
If he is your relative, then you have to take him forcibly, or if he doesn't come even forcibly, approach the doctor on your own, describe the symptoms to the doctor,
okay,
who will make a diagnosis and give you the treatment to be given to him.
okay,
If you're not related,
Yeah.
you inform the relatives of that person.
okay. This is a good idea.
Let me explain a little about this hallucination and delusion. Let us say that the person who is sitting on the chair and watching TV. Now, on the TV screen, what does he see? What is transmitted by the TV center. Now, suppose a cable connection is made and about which the person does not know, and the cable is playing. What will the person think he is watching on the TV screen?
What is being
It
transmitted?
has been transmitted from the
TV center.
TV center.
So he will tell others, okay, this is what was shown. And others will say, we were also looking at it. Nothing like this was shown. Now who's right? In the same manner, this is the person, this is the mind, this is the mental screen, and this is the reality outside. Now the reality stimulates our sensory organs, and the nerves carry the sensation up to the brain, and the reality is recreated on the mental screen, which now the person experiences. Now, because of the dopamine increase in the junction of the nerves, what is reflected on the mental screen is not the reality, but a distortion of the reality. And the person believes those distortion to be real. Because since the beginning of life, whatever came on the mental screen was always in keeping with reality. Now, any amount of argumentation, any amount of trying to explain to the person or to prove to the contrary will not be acceptable. Because his personal experience is different from what you are telling him. And that is why the person is not in contact with the reality and therefore has this loss of insight. And because of this loss of insight, the person refuses to even see a mental health professional. So, these people don't come to the doctor, they are brought to the doctor. Do not waste your time in trying to convince the person. To help him, you may give him the medicines even surreptitiously by mixing them in the food so that he is benefited. But this loss of insight is one of the biggest hindrance in the treatment of these types of patients. So, in this episode, we have seen some major symptoms which are indicative of mental ill health. From next episode, we shall see some of these illnesses in greater detail.